Usually, breast cancer starts in a way we call it asymptomatic, meaning a lady may not feel anything. But usually it would present with a lump, which is usually painless. A lady might also have thickening of the skin of the breast. In other words, it changes from what she has been used to. At times the nipple can be inverted, so from facing outside, it now faces inwards because of pulling of the tumor. Then also there can be a nipple discharge. So it could be bloody or mucoid, mucus, or then that would make you suspect cancer. The other one is also a swelling in the armpit, because the lymph nodes of the breast go into the armpit. So if a lady gets a swelling in the armpit, we need to have a look. Men do also get breast cancer, and theirs is actually more serious than the one for the ladies, only that it's rare. So it's about 1% of men who get, and it can be quite aggressive. Like any cancer, if it is found early, the treatment is much cheaper, and also the response is better. So screening is important, where, as we had said, doing the breast examination. We encourage a lady to do it even monthly. Partly it's to create awareness, so that a lady is aware that there's a condition called breast cancer, and they can test themselves for it. So for those ladies who have a family history of breast cancer or ovarian cancer, especially if it's a first-degree relative like your sister or your mother, then we do some tests. The common one is called BRCA1 or 2, and those ones can tell us whether you're at high risk of developing breast cancer. And in some situations, if somebody does have a high risk, then after they have had their children, then at times they can even be recommended to actually remove the breast to avoid getting cancer. There are ladies in this country who have never heard of breast cancer. So by them hearing about it, it now makes them think and say, oh, what can I do to prevent it? And so they would go for screening. Insurance, they can now take insurance to be able to do the tests and the treatment. Some of the treatments can be quite expensive, and so insurance would come in. Well, for breast cancer, smoking and alcohol does increase the risk of breast cancer, so those can be changed. Others may not be so easy because, for example, one of the risk factors is ladies who have not breastfed are more likely to get cancer. Ladies with no children are more likely to get breast cancer. And so, of course, one of the advantages then would be if a lady has breastfed, then the risk gets lower. So any lady who has a child would encourage to breastfeed for even longer, because that does reduce the risk. So if found early, then that makes a huge difference. And that's why having the Breast Cancer Awareness Month, educating ladies about self-breast examination and doing mammograms, it makes a huge difference, because during the Cancer Awareness Month, many women are found to have a growth which is early, and they had not even felt it. And so when that happens, then even minor surgery can be done. You don't need to have the whole breast removed. They can remove a part of the breast. And rather than finding it when it's in stage 3 or 4, where treatment now becomes very difficult.